As a matter of fact, I believe that in a developing country context, especially, for example, in Africa, we have very good doctors, but these doctors are very familiar with infectious diseases. So if they see signs and symptoms which they are not familiar with, then they might think of a different cause of a disease. That was one of the very early trigger points in the Angola event, that the doctors familiar with the infectious diseases in the country haven't seen this before. That's number one. But number two is really that some signs and symptoms exclude maybe an infectious disease, while other signs and symptoms favor a non-infectious disease or chemical-related etiology. And I think that is what happened in Angola as well. I think we didn't see any fever, for example.
Yeah. So fever is a common feature of an infectious disease, but it's a relatively uncommon feature for a chemical-related illness. There are some chemicals that cause elevated temperature, but you don't tend to see hundreds of people, as in Angola. I mean, if you saw hundreds of people with an elevated temperature, you wouldn't be thinking chemical, you'd be thinking infectious disease. Of course, from poisonings, you can, in a group of people, have some people with a fever because they may have a concomitant infectious disease anyway. They might have malaria, for instance. I mean, we've certainly seen cases of mass poisonings where there are a proportion of people with elevated temperatures because they've got malaria or they've got another disease that's endemic in the area. But if you've got a lot of people, hundreds of people in Angola were essentially asleep and then woke up a few days later and then recovered fully, that characterises a chemical, I think.
Yeah.
Whereas if it was some kind of disease process, people wouldn't just wake up in 2 days and be back to normal.
Yeah.
So because people waking up, that what that says is the chemical has been metabolized, eliminated from the body, and it no longer has an effect.
First, also the distribution of cases can give some indications. So in Angola, for example, there were mainly the children in the huts, sometimes the mothers, but rarely the fathers. So, and then it was not a cluster of huts, but the people affected, they lived partly apart from each other. So maybe for infectious diseases, you would, because of transmission and so on, so you would expect a different pattern. That can give you an indication. So the cases were concentrated in a hospital. In a hospital, they were treated. And so the chemicals were excreted and metabolized or whatever, and they become well again. So they came back to the community, and a day later they became dizzy again, they fell asleep, they were like in a coma type of thing. So that can give you also the idea that there was an exposure. The exposure was disrupted during the time of the hospital, and when the people came back to their homes, exposure started again, and in fact that was the case. So the signs and symptoms, fever or not, for example, the pattern, maybe huts or families or partly family, the children, for example, because they have small body size and weight, or disruption of potential exposure. These are all indications which can give you a clue as to whether a chemical is being involved. And for experts, it can give you also a clue what type of chemicals, especially when we talk about the signs and symptoms.
I think on the what kind of chemical side of things, though, that can be a challenge, because with Angola, when we looked at all the chemicals that can cause CNS depression, well, there are hundreds of drugs for a start that are CNS, well, not hundreds, but a lot of drugs that are CNS depressants. Organic solvents cause CNS depression. I mean, there are just lots of chemicals, and trying to narrow it down and identify the chemical that caused the illness, that involved a bit of detective work as well as extensive laboratory analyses.
But even the laboratory analysis is very difficult to get it in a low resources type of context, because especially where you haven't identified the chemical hazard, you ask the laboratory to analyze for a substance. But then when you're not sure about the substance, you have to run surveys of groups of substances or groups of drugs, and not all laboratories have this capacity in place. I mean, this is very challenging.